Hey, this is Dr. Finks from the University of Tennessee College of Pharmacy, and I have with me today Dannia Quran, who's a fourth year pharmacy student.
And for my Finks 5, I picked the topic Practical Tips on Administering Insulin. Here's some general information on insulin. Most insulin vials or pens contain 100 units per ml, with most pens containing a total of 3 mLs. In addition, most pens deliver 1 unit per increment, except for U500 and the Tresiba 200 unit pen. For practical purposes, an increment is equivalent to the 1 click you hear. So just remember to be careful with dosing options so that you are aware of how many units are delivered per click. We will address insulin pumps in another Finks 5, but keep in mind that only rapid and short-acting insulin should be used in insulin pumps. Importantly, needles are not included in multi-dose pens, so you want to make sure each patient receives a prescription for the needles that go with their insulin. There are several multi-dose insulin pen options available, and they contain different insulins. Of course, pens offer the advantage over vials of insulin and that dialing up a dose is much easier. However, these insulins are more costly. Again, remember that needles are not included with the pen prescriptions, so please make sure the patient receives both. NovaPen Echo is the first ever reusable insulin injector pen with dose memory that tells you how many units were ejected and the time since the last dose. This device, which uses Humalog insulin, may be used by adults and children with type 2 diabetes. NovaPen Echo also offers fine-tuned dosing in half increments, which is advantageous in children. To activate the dose memory, first pull out the dose button, then push it back in. Display will show how many units were last injected and how many hours have passed since then. The number in the middle display represents the number of units injected. Each segment around the edge represents 1 full hour that has passed since last injection. Humalog Junior KwikPen is specifically indicated for the use in children with type 1 diabetes who require smaller doses of insulin compared to adults. Insulin pens are a convenient delivery system for quick dosing. In order to use one, you will need to choose a pen needle that meets your patient's needs and works with the pen devices they use. Remember that a fresh, sharp needle for each injection is best practice and can reduce any pain from giving yourself a shot. A few things to consider when picking a pen needle is the length and the width of the needles. Pen needles come in a wide range of lengths, from 4 to nearly 13 millimeters. A short pen needle can be used effectively for people of all sizes. Kids in particular may want to use a short needle to avoid injecting insulin into the muscle. It is the width of the pen needle and not the length that can cause painful sensations upon injection. Needle widths are measured by gauge, and the higher the number, the thinner the needle. Needle gauges range from 29 to 32. The advantages of a thicker needle include the ability to give a larger dose more quickly and a lower risk for leaks from the skin, which can occur when the insulin does not reach the fatty tissue where it needs to be deposited. Thicker needles also require less effort to deliver a dose because more insulin can be delivered quickly. Note that all BD pen needles are available over the counter. Depending on the patient's insurance, it may be cheaper for the patient to purchase their own needles. Most boxes of pen needles contain 100 needles per box, so be sure to ensure the patient receives the correct amount of needles in relation to the number of times they must inject themselves. If you don't go with a pen device and your insulin is drawn up from a vial, you need to be aware of the sizes of syringes available. The size should be chosen by the volume to be injected as well as the gauge of the needle on the end. As pharmacists, we can run a prescription through to try to get these syringes covered by the patient's insurance. For a comfortable injection experience, especially for those afraid of needles, shorter needle lengths are recommended and preferred. The first picture depicts the depth of a NovaFine Plus needle, which is 4 millimeters, in comparison to a standard pen needle, which is 8 millimeters. Injection technique is actually different for the standard pen needle. Any needles that are 8 millimeters or above require you to pinch the skin before administering the insulin. Be sure you pinch the skin only, meaning don't grab the muscle. In addition, you must twist the needles on the pens before administering the insulin for each use. This is how to insert needle to pen. Step 1. Pull the pen cap straight off. Do not remove the pen label. Then wipe the rubber seal with an alcohol swab. Step 2. Select a new needle. Pull off the paper tab from the outer needle shield. Step 3. Push the cap needle straight onto the pen and twist the needle on until it is tight. Step 4. Pull off the outer needle shield, do not throw it away. Then pull off the inner needle shield and throw that away. Once you eject your insulin, you will place the outer needle shield over the needle to remove it from the pen safely. To properly dispose of used needles, place them in Sharps container or any container that has a lid and is strong enough to keep the needles from sticking out, like an old detergent bottle. Milk jugs are not recommended because the plastic is too thin. Once container is full, make sure the cap is screwed tightly on and place the container in the center of your garbage to dispose of them correctly. Keep containers away from children. Recall that Humulin R U500 should only be for patients requiring more than 200 units per day. When a patient requires more than 200 units of insulin a day, changing to U500 can improve blood glucose control and provide more comfort with fewer injections because it is 5 times as concentrated. This insulin must be drawn up from a vial, so patients will need to receive U500 insulin syringes if prescribed this formulation. Be sure they receive the syringes specified for U500 insulin, which will have a green cap. There is also a KwikPen option that might be more convenient for patients. Of course, when teaching patients how to draw up insulin for the first time, they may be overwhelmed. You can find many helpful pictorials online that can make this process very easy. We have included 4 within this slide set, and the website is denoted on each slide for you to download if you find them useful. When injecting insulin from a vial, wash your hands first. It is important to remember to roll the vial and not shake it because shaking will denature the protein. You can inject the exact units of air into the vial for easy withdrawal of the insulin. Don't forget to use alcohol swabs on both the vial and the site of injection. When you are drawing up NPH and regular, it's one more step. Just remember to inject air units into the NPH first, but always remember to draw up the clear, which is the regular insulin, before the cloudy, which is the NPH insulin. With disposable pens, it's important to prime before first use. Priming your pen means removing the air from the needle and cartridge that may collect during normal use and ensures that the pen is working correctly. If you do not prime before each injection, you may get too much or too little insulin. To prime your pen, turn the dose knob to select 2 units. Hold your pen with the needle pointing up. Tap the cartridge holder gently to collect air bubbles at the top. As for dosing, you dial up the units and then you can inject in the preferred subcutaneous location once the needle is attached. When all of the insulin is used from the pen, after all 300 units, you can simply discard the entire pen into your needle carton or Sharps container. Finally, some pens have disposable cartridges. It is basically the same process of injection as the disposable pens, but rather you keep the pen and just change the insulin cartridge when empty. Here are the sites where you can inject your insulin. Note that the abdomen is the best place to inject insulin because your abdomen area can absorb insulin most consistently. But other subcutaneous sites, such as the back of the arms, thighs, and buttocks, are acceptable alternatives. Injecting the same spot every time can form bumps and bruises on the skin. It is recommended to rotate the injection sites on the abdomen. Ways to rotate injections are shown here. You can inject sequentially in a horizontal manner across the abdomen, avoiding the belly button, or you can inject in an S shape around the abdomen, being careful to avoid the immediate area of the belly button. Sometimes you may get a question from patients like, how long can I keep my insulin? Insulins that are unopened and refrigerated remain stable until their expiration date. Once removed from the refrigerator, insulin pens containing regular human insulin can be stored at room temperature for 10 to 14 days, and pens containing insulin analogs like Lispro, Aspart, Glargine, and Detamir can be stored at room temperature for 28 days, and then they must be discarded. Exceptions are the ones that are depicted on the timeline, including as short as 3 days with Afrezza, the inhaled insulin, and as long as 56 days with Tresiba. Some patients may be overwhelmed with the thought of injecting insulin. However, with multiple formulations available, this task may not be as daunting. Insulin can be chosen to fit the needs of a patient, whether it be a vial or pen. We as pharmacists should make sure that the right needles or syringes are prescribed based upon the dosage form of insulin, as well as teaching the patient the form of sterile technique and the preferred subcutaneous injection sites. Finally, knowing at which time to discard the insulins for best practice is important.
Thanks so much to Dannia Quran for preparing this Finks 5, and a special thank you to Dr. Jennifer Campbell and Liz Warhurst for their peer review.